So tummy tuck, which is the commonest thing, I thought liposuction would be my number one procedure. No, tummy tucks actually, because I see normal people here. Couple of kids, gain weight, lost weight, and then you need to do this. So remove the excess skin, tighten the muscle, reposition the umbilicus. Some people can't have it because of surgeries or other conditions. When you look at someone's belly, again, it's the holistic approach. The belly is attached to the flanks, attached to the back. I can make you super snug in the front. If you lose here, guess what? It's going to even out somewhere. So we try to do a tummy tuck which is designed for certain operation. Beyond a certain weight loss, you will need more than a tummy tuck. But for most people, say what bothers me at the front, and then look at the back. So I've done the 360 body lifts a few times, like a charm, lifting the buttocks, giving you the waist, tightening the belly. It's awesome. A lot of surgery, and most people just bothered by the front. So when you look at it, the belly button is like a scar, really, fixed point. So there's a bulge above it, there's a bulge below it. Some people have more than one bulge. And if you have a section, that's another bulge. So you look at the profile, you see all these folds. Fullness of the flanks goes all the way to the back. Dorsal love handles, the one by the buttocks. So you have to look at all that and understand the relation. Also the attached to the thigh affects the thigh. So when we look at someone, we do a tummy tuck. Usually we make the incision lower, as low as we can. And we go all the way to the belly button if we can. We like to remove all the area that's white. So all the skin that you can grab usually will come off. And any stretch marks in that area, any scars will be gone. Anything outside will still going to be there. Then the fat below that flap of skin, we actually thin it. And then we do some liposuction by the flanks, trying to make the waist a little better. So here we dealt with the fat and we dealt with the skin. We're still missing one huge component of that. And that's this fun part, the muscle. You can do a zillion sit-ups a day. You're not going to move your muscle to the center. You're going to get stronger to stay where they don't magically move. I actually had to physically suture them down. I have the problem myself. And it has to be sutured. And everyone gets the rectus muscle. And almost everyone gets the obliques. You do this, then you actually can tighten the muscle. That's what bothers you after the surgery. It's not this. The skin is numb or anything else. It's just the movement with the muscle. And then we do what we call progressive tension closure right now for the last 3-4 years. I don't use any drains anymore. It made life so much easier. So that's the advantage for going to all this meeting. We always, it's a craft. You're working with your hands. You want to make it better. Every time I learn something new, we bring it here so we can make the operation better. So we eliminated the drains virtually. Almost everyone goes home the same. Hardly anyone spends the night in the hospital with that. So you can do this. You tighten the muscle, remove the fat, and tighten the skin. Then you can take someone from looking pregnant to someone looking flat. Nothing wrong with diet and exercise. She needs to maintain. She loses a few pounds out until she looks even better. I had some people actually get pregnant after a tummy tuck. Not supposed to. The sky didn't fall. I mean, you can still maintain it, but these are powerful operations. So when you look at anything, you have to decide, is it for me? Is it really important at this point in my life? And you have to make that ethical decision. Then you go to someone who's should offer you the whole discussion. It should never be rushed. And should be something reasonable. And you look at the risks and benefits, and if it's something to you, it can be beneficial.